Hello and welcome to Point of View Podcasts, a series of conversations from Kaufman Hall and Associates about the challenges and opportunities now facing hospitals and health systems. The advent of public and private health insurance exchanges is accelerating healthcare's transition to a value-based business model. A carefully developed exchange strategy can help healthcare organizations prepare for the pressures and possibilities that go along with these changes. Andrew Cohen, a vice president in Kaufman Hall's strategic advisory practice, joins us to discuss hospital readiness for the exchanges. Andrew, let's start with a definition of health insurance exchanges. What's occurring with exchanges now, and what will we likely see coming up next year?
Healthcare exchanges are essentially marketplaces for individuals and employers to purchase healthcare coverage in an online and over-the-phone type of marketplace. There'll be two types of exchanges, both public and private. The private exchanges will be available to large and mid-sized employers, while the public exchanges will be available to individual and small business owners. So we see a variety of things happening over the next several months and years with regard to exchanges. With the public exchanges, open enrollment begins on October 1st of 2013 for coverage to begin on January 1st, 2014. We also expect the private exchanges really to be more of a staggered start, as that they'll be focused with large employers, and the large employers are really going to be the ones initiating these private exchanges. So we expect the rollout of the private exchanges to be somewhat slower than the public. However, we do see both of these being very important and very active in 2014 and beyond.
How important are these exchanges in thinking about the future landscape of health insurance?
Very important. We expect exchanges to be significant starting in 2014 and over the next 5 years. The market is essentially shifting from a wholesale purchasing of benefits to a retail model. And because of that, we see the availability of insurance now, not only for the currently uninsured, but we also see exchanges playing an active role in the currently group insured marketplace as well.
What role might the exchanges play in that shift?
The exchanges will play a very important role in this shift. The private exchanges, again, will be a way for employers to distribute benefits to their employees and offer them a greater amount of choice at potentially a greater cost savings than they currently experience today. The public exchanges will provide opportunities not only for small businesses, but for currently uninsured individuals who today don't have access to affordable care. They'll be able to go to the exchanges and purchase coverage, compare and contrast plan choices and coverage options, and be able to see exactly what their costs are going to be, both from a premium perspective and an out-of-pocket perspective.
What opportunities and challenges do these exchanges present to healthcare organizations?
I think there's a variety of changes that we expect to see for providers, specifically reimbursement challenges, patient volume challenges, bad debt and collection challenges, as well as price transparency and quality requirements that will propose new challenges to providers.
What about opportunities?
Well, I think there's certainly opportunities to gain increased market share, enhanced revenue, brand reputation, and the ability to carve certain providers out of the network to increase volume within their respective markets.
How can organizations prepare for these changes?
Organizations need to do several things. One, they really need to think about what's their exchange strategy. And from there, they really need to build a strong financial plan that's going to support that strategy. Taking those two pieces, you really need to develop a tactical plan to figure out how and when you're going to be participating with exchanges. Providers are also going to have a proactive role in approaching payers to determine what options exist in their respective markets. Providers should not wait for the payers to approach them. Rather, providers should approach the payers if in their markets, if appropriate, to determine what options are available as far as participating in the exchanges, both on the public side and the private side.
So what are some of the key questions that hospital and health system leaders should be asking in developing an exchange strategy?
Well, there are a variety of key questions that organizations need to be asking. One, what proportion of our market is likely to purchase insurance through exchanges? You really need to look at what commercial insurance is being provided today to patients, and then look to see what percentage of that population will shift to exchanges, be it private or public. What effect will the exchanges have on the size of our currently commercially insured population and the reimbursement rates that we receive for that population? Will we participate in exchange offerings? And if so, which health plans, employers, payers, and providers do we need to work with? Do we look for narrow network opportunities? What other types of plan designs might be out there that will impact whether or not we play and how we play? And then I think some of the other questions I think would be important would be, what's our contracting strategy? Do we contract independently? Do we partner up with our physicians within our organization or in the community? Or do we look for other organizations in the community to partner with? There will also be opportunities to partner directly with employers as well as new health plans that will be coming into the market because of exchanges. And finally, what's the reimbursement contracting models do we really want to pursue? Right now, largely capitation is not something that's being experienced across the country. Most reimbursement is a fee for service, but we expect to see value-based reimbursement really increase as exchanges grow in popularity. And then finally, really what's our pricing strategy going to be as we go to market? We look at these new exchanges and we look at these new contract models.
Will contracts be different between public and private exchanges?
That's a great question. We really, at this point, really don't see a lot of difference between public and private exchange contract rates and methodologies. I think the payers certainly have limited contracting resources, and they've got competing priorities that really aren't allowing them to go out and define separate strategies and contract rates for these exchanges. So what we expect is there to be similar types of arrangements and reimbursement rates for both public and private.
What can we expect to see with regard to reimbursement rates?
We're seeing a variety of different rate scenarios play out around the country. In some markets, providers are being approached and accepting rates that are very similar to, if not exactly the same as their current commercial rates. However, in other markets where there's greater competition and more pricing pressure for lower premiums, we're starting to see the rates trail lower, much lower, in fact, somewhere between Medicare and Medicaid, or sometimes between Medicare and the current commercial rates. The important thing to know is that there will be a variety of different scenarios playing out around the country. And it's important for providers to strongly consider and understand the ramifications of these new contracted rates and the ramifications on their current commercial business, as well as the upside opportunity from the currently uninsured that will now be shopping through the exchanges.
What do we see over the next few years as far as people with commercial insurance on the exchanges shifting over?
Well, we've done several models around this, and there's a variety of different opinions out there. But we see potentially up to 36% of any facility's current commercial population shifting over to the exchanges. And a large number of those, probably more than half, shifting over to private exchanges, the other half moving to the public exchanges. In some scenarios that we've seen and we've seen that shift to be as high as 66% over that 5-year period and as low as 17%. There's going to be many factors that are impacting these numbers on a market-to-market basis. And that really underscores the importance that you really look at the local market conditions to really understand and predict exactly what's going to shift and when it's going to shift.
What factors should organizations consider in determining when to begin participating in exchanges?
Well, certainly there's going to be a variety of factors, but I think one of the most important factors to consider is what's your position in the marketplace today and what type of rates do you have? I think some of the advantages of certainly moving quicker rather than later is that there's a potential to capture the initial wave of people that will be coming in through the exchanges. There's also opportunity for priority access to narrow network contracts that may carve other providers out. And certainly there's opportunity for new revenue growth. However, there may be some risks involved as well.
Are there instances when holding back and waiting might be advantageous?
Absolutely. I think there's a lot of unknowns with exchanges. Many of the payers, the employers, states, governments, individuals, and providers have really no sense as to how successful these exchanges will be, who will be enrolling in the exchanges, and what the uptake rates are going to be. So I think there's certainly a risk by going in too early and potentially accepting lower rates, for instance, or perhaps getting locked into unsustainable long-term contracts that may not be advantageous over the next several years.
What role can hospitals play in helping patients enroll in health insurance coverage?
Well, certainly there's the back-end planning that needs to occur at every hospital with regard to exchanges. But there's also a role on the front end of the organization to really promote the healthcare exchanges and to really help individuals that present at the hospitals to better understand what their coverage options are. So there's a variety of things they can do. There's also a variety of resources that are already in place today to help uninsured that present in the hospital enroll into things like Medicaid. There'll be new opportunities to leverage these same resources and others to be able to take advantage of enrolling the commercially eligible as well as the Medicaid eligible folks.
And what about becoming a certified enrollment entity?
Yes, I mean, there's both state and federal resources out there, grant money and other, to really promote the certification and education of individuals and organizations to really help individuals understand what are these exchanges, why are they important, what are my coverage options, what are the prices going to be, where do I need to go? These are all very important questions that individuals will be coming to providers with. And it's important that providers have the necessary information, the training, and the certification levels necessary in order to make sure that people get the right information at the right time to get the coverage they need.
What are the broader implications of health insurance exchanges in the context of the transition to a value-based delivery and payment model?
Well, as we spoke about before, value-based reimbursement is something that's really starting to emerge across many markets. We're seeing the development of such things as accountable care organizations or clinical integration programs. All of these strongly relate and tie to value-based reimbursement. Exchanges will accelerate and support the growth of value-based reimbursement and value-based care delivery. So it's critical that organizations have a true understanding on what their risk tolerances are, what their value-based readiness is, and what things that they need to do within their organizations to prepare for these types of things. Exchanges will be an accelerator for these types of programs, and we expect many providers to be faced with important options with regards to the type of reimbursement arrangements that they participate in and also the rates in which they're reimbursed.
You mentioned they will accelerate the transition to a value-based model. What does that mean in terms of transparency?
Well, transparency is a word that we're hearing more and more about today. And certainly there's as high deductible health plans become adopted in greater volume, there's going to be a need for price transparency and quality transparency. The large insurance organizations that are offering these types of plans are now providing tools for individuals to be able to go out and use to evaluate what's the cost of providing or of receiving care within my community, and what's the quality of the providers that are providing that care. One of the things that we'll be able to look at through price transparency tools is a balance as to what the cost is and what the quality is. This will force providers to think about what is the cost for me to provide these services and what are the prices that I charge. Exchanges will accelerate the use of high deductible plans and narrow network plans, which will force providers to really think about exactly how much services they're providing and at what cost.
That was Andrew Cohen, a vice president in Kaufman Hall's strategic advisory practice. For more in our Point of View podcast series, go to kaufmanhall.com.